So now we are going to study about Cushing syndrome. हम सब ने cortisol के बारे में पढ़ लिया था and we have understood that Cushing's is nothing but hypercortisolism. मतलब जब बॉडी में cortisol बढ़ जाएगा that will cause Cushing syndrome. Okay. So we have read about the source, the regulation, the function of cortisol, and also about the apparent mineralocorticoid excess, which is the autosomal recessive disease. Now we are going to study about Cushing's proper. What is the cause of Cushing's? To understand that, you have to understand that Cushing's is because of increased cortisol in the body. Okay, so increased cortisol is secreted by adrenal zona fasciculata. Now to understand better, हम एक डायग्राम बनाएंगे. Let's say this is your pituitary. Say this is your pituitary. I don't know how to draw it properly. This is your pituitary and this is your adrenal. So pituitary will secrete what? ACTH, and adrenal will secrete cortisol. So the most common cause of hypercortisolism is exogenous corticosteroids. जो हम बाहर से स्टेरॉइड्स देते हैं, that is the most common cause of this hypercortisolism. Now it does what? ये यहाँ से आके it suppresses the adrenal also, it suppresses the ACTH from the pituitary also. Okay, and this causes what? Bilateral adrenal hypertrophy. This causes bilateral adrenal atrophy. Second cause we can understand is that primary adrenal adenoma. Adenoma. Now we have understood कि cortisol तो यहीं से निकल रहा है. Now if there is any adenoma, or if there is any hyperplasia, or if there is any carcinoma, ठीक है, hyperplasia or carcinoma of the adrenal gland, then it will have same effect as this. Okay, so उससे भी cortisol बढ़ जाएगा बहुत ज़्यादा. Okay, so इससे भी cortisol बढ़ जाएगा. फिर थर्ड है, इससे भी we have understood कि ACTH कम हो जाएगा, decrease ACTH. Now if there is some defect in the pituitary itself, तो pituitary का defect क्या हो सकता है? ACTH secreting pituitary adenoma. ठीक है, तो अब यहाँ पे ACTH बढ़ जाएगा. There is no doubt about that, I hope. तो यहाँ पे ACTH बढ़ जाएगा and that will increase the cortisol in the adrenal. Okay, so this is also called Cushing's disease. What? Cushing's disease. Not Cushing syndrome, Cushing's disease. Okay, now there can be some paraneoplastic increase also. Like in small cell cancer, small cell lung cancer, bronchial carcinoids. So okay, so we have to understand this. If there is some problem or cancer it can also lead to increased cortisol. So you just have to remember this diagram. ACTH बढ़ गया मतलब ACTH secreting pituitary adenoma, cortisol बढ़ गया due to exogenous corticosteroids which is the most common cause, इसमें atrophy हो जाएगी. प्राइमरी एड्रेनल एडेनोमा है या हाइपरप्लेजिया है या कार्सिनोमा है, किसी एक एड्रेनल में हाइपरप्लेजिया या कार्सिनोमा हो गया है तो दैट विल ऑल्सो लीड टू इंक्रीज कॉर्टिसोल. हाँ, इसमें याद रखो कि द अदर ग्लैंड जिसमें कि एडेनोमा नहीं है उसमें एट्रोफी हो जाएगी. ओके, so this is all the causes of the Cushing syndrome. Now we'll study about the findings which we find in the Cushing syndrome. So we have to understand कि cortisol करता क्या. The main things that cortisol does is hypertension because alpha 1 receptors पे काम करता है. We have studied about that in the cortisol video. Hypertension, hypokalemia and acidosis, alkalosis. So ये कैसे करता है? By inhibiting RAS and by increase sensitivity of alpha 1 receptors. Okay, so this is the main functions of the cortisol. So effects of protein. So now we have to understand कि क्या क्या होता है. Okay, so we will do that maybe in the next video. In this video only we have look upon the etiology. Okay, thank you.